Okay, so to really get this, I want you to picture your body as this massive, bustling city, right? Every building, every office, every home, those are your cells. And just like any city, they need power, they need fuel to keep the lights on. For your body, that fuel is glucose. It's a simple sugar. So here's the big question. What happens when that fuel system just breaks down? What if the fuel trucks can't make their deliveries? That's the heart of the issue right there.
And that breakdown, well, it creates what's basically a biological traffic jam. The whole point is to get that glucose from the bloodstream, which you can think of as the city's freeways, and deliver it into the cells. But when that process hits a snag, bam, total gridlock.
So this citywide traffic jam, it's got a medical name, hyperglycemia. All it means is high blood sugar. You've got all this fuel, all this glucose just piling up on the highways, but it can't get off the exit ramps to the buildings that are desperate for it. And this one single problem, this is the root cause of everything we're about to get into.
Okay, so why? Why does this gridlock even happen? Well, it turns out there are really two main culprits, and they define the two big types of diabetes. And it all comes down to this one absolutely critical hormone called insulin. The best way to think about insulin? It's the key. It's the key that unlocks the doors to your cells so that glucose can get inside.
And this right here breaks it down beautifully. On one side, you've got type 1 diabetes. Let's call this the lost keys problem. The body's own immune system gets confused and attacks the very cells in the pancreas that make insulin. So, poof, no more keys are being made, an absolute lack of insulin. Then you've got type 2 diabetes. This is the jammed locks problem. The keys, the insulin, are there. In fact, the body might be making even more keys to compensate. But the locks on the cell doors are rusty, they're jammed, the cells have become resistant, so the keys just don't work like they should. So what happens when this gridlock goes from being a chronic problem to a full-blown acute crisis? We're talking about a life-threatening emergency. And it turns out the kind of crisis you get depends completely on which problem you have, the lost keys or the jammed locks.
Okay, let's look at these two emergencies. On the left, DKA. This is the classic crisis for type 1. With zero insulin, no keys, the cells are starving. So the body panics and starts burning fat for energy. The problem is, this process creates these acidic things called ketones, which build up and make the blood dangerously acidic. You might even smell a fruity odor on the breath. Now on the right, you have HHS, which is more common in type 2. Here, you've got some insulin, just enough to stop that massive fat-burning process so you don't get the ketones. But the blood sugar can climb to insane levels, way higher than in DKA, leading to severe, life-threatening dehydration.
All right, so long before things get to that crisis point, your body is usually waving some pretty big red flags. It's sending out warning signs that this glucose gridlock is causing some serious issues. So what are these alarms we should be listening for? They're famously known as the 3 Ps. It's like a domino effect. First up is polyuria. You've got so much sugar in your blood that your kidneys go into overdrive trying to flush it out. But to do that, they have to pull a lot of water with it, which means you're going to the bathroom a lot. And of course, that leads directly to domino number 2, polydipsia. You're losing all that water, so you become incredibly thirsty. And finally, you get polyphagia. This one's kind of ironic. You have all this sugar floating around, but your cells can't use it, so they're literally starving. They scream to the brain, "We need fuel," and you feel constantly excessively hungry. Now, what if this high blood sugar isn't just a temporary thing? What if it goes on for years and years? Well, that constant low-grade traffic jam starts doing more than just slowing down fuel delivery. It starts to damage the infrastructure of the city itself. The roads, they begin to crumble. And in your body, the roads are your blood vessels. And this damage happens on 2 different scales. First, let's talk about the big ones, the macrovascular damage. This is damage to your large blood vessels, the main highways of your body. All that excess sugar basically speeds up the process of atherosclerosis. That's the hardening and narrowing of your arteries. And when your main highways are clogged and damaged, it's no surprise that your risk for a heart attack or a stroke goes way, way up. But it's not just the highways. The damage also happens to the small, delicate vessels, the microvascular system. Think of these as the city's local streets and alleyways. When these get damaged in the back of your eye, we call it retinopathy, and it can cause blindness. When it happens in your kidneys, it's called nephropathy, and it can destroy their ability to filter your blood, leading to kidney failure. And it doesn't stop there. High blood sugar also attacks the city's communication grid, your nerves. This is called neuropathy.
Basically, the high sugar concentration damages the nerve cells themselves, causing them to malfunction. This often leads to a loss of feeling, especially in the feet. And that's incredibly dangerous, because you might not feel a small cut or a blister, which can then get infected and turn into a major non-healing wound, what's known as a diabetic foot ulcer.
Okay, so we've laid out the problem, the crises, and the long-term damage. That's a lot, I know, but understanding it is the first step to fighting back. So, how do we officially diagnose this? And more importantly, how do we get the city's fuel system back online? One of the most powerful tools we have for diagnosis is something called the hemoglobin A1C test. Now, this isn't just a snapshot of your blood sugar right now. It's more like a highlights reel of your blood sugar over the past 3 months. It gives us the average, so you can think of it as your long-term report card for blood sugar control. And if that report card comes back with a 6.5% or higher, that's a diagnosis of diabetes.
So let's talk treatment. For type 1 diabetes, remember, that's the lost keys problem. The solution is actually pretty logical. If the body isn't making the keys, you have to give them back. The treatment is insulin. It's all about providing the body with the insulin it can no longer make for itself, managing it carefully to keep that glucose gridlock from ever happening. Now for type 2, the jammed locks, the strategy is a bit different. It's a progressive step-up approach. You start with the foundations, lifestyle changes like diet and exercise, plus a workhorse medication called metformin that helps reduce that insulin resistance. You give that about 3 months. If you're still not hitting your A1C goals, you add a second medication. Still not there? You add a third. And if that's still not enough, you can even add insulin to the mix to provide overwhelming key power to finally get those stubborn locks to open. So at the end of the day, understanding this is so important. Knowing the difference between lost keys and jammed locks, seeing how a simple glucose gridlock can wreak havoc on the entire body, from our biggest arteries to our tiniest nerves, it's really powerful stuff. And it leaves us with a pretty big question to think about. With millions of people living with this, what does taking proactive control of our body's fuel system really mean for our health and for the health of everyone around us?